Welcome to Allied Health 3, Pharmacology Clearance Simple, lecture for Chapter 13, which is Nervous System Medications. Our objectives for this chapter are to be able to define all key terms, identify the two major branches of the nervous system, recall the 5 categories of nervous system medications, identify 4 categories of medications used to treat pain and fever, recall at least one category of medications used to treat anxiety, insomnia, sedation, and seizures. Identify at least one category of medications used to treat behavioral, emotional, or mood disorders. Discuss medications used to treat psychosis and identify other disorders for which these medications may be prescribed. Recall at least one category of drugs used to treat dementia or 2 categories of drugs used to treat Parkinson's disease. Compare and contrast the actions of local and general anesthetics, and discuss how alcohol can influence medications use and its effect on the body. Let's start by looking at the nervous system. So the brain processes information and tells the body how to respond. The nervous system is divided into the central nervous system, the CNS, and the peripheral nervous system, which includes the autonomic nervous system. The central nervous system includes the brain and spinal cord and contains billions of neurons that make communication and interaction possible between the brain and the rest of the body. The peripheral nervous system consists of the somatic, which is voluntary, and autonomic, which is involuntary nervous systems. The somatic nervous system controls those muscles that we have conscious control over, and the autonomic nervous system controls our internal organs. The autonomic nervous system is broken down further into the sympathetic and parasympathetic nervous systems. The sympathetic nervous system controls the body's fight or flight response, and the parasympathetic system helps the body to rest and relax. So, nervous system medications, they're used to treat pain, anxiety, depression, mania, insomnia, convulsions, schizophrenia, and they act on the central nervous system and the peripheral nervous system. So most drugs act at the synapse between nerves and adjust the transmission of messages between or by the neurotransmitters. So let me say that again more slowly. Most drugs act at the synapse between nerves and adjust the transmission of messages by the neurotransmitters. Medications work by either exciting the central nervous system or depressing it. These drugs are powerful enough to cross the blood-brain barrier and thus have serious side effects. So neurotransmitters are the chemicals that facilitate the movement of messages across the synapses. Here's our first checkpoint. Comprehension checkpoint 1. The peripheral nervous system is divided into, if you chose C, the peripheral nervous system is divided into the somatic and autonomic systems, you are correct. Acetylcholine and norepinephrine are 2 neurotransmitters that affect the autonomic nervous system. A nerve cell that releases acetylcholine is called cholinergic, and cells that release epinephrine or norepinephrine are considered adrenergic. These substances occur naturally, but we administer artificial forms when the body's responses are not appropriate to counteract disease. Sympathomimetics, also called androgenic agonists, are medications that stimulate the sympathetic fight or flight impulse. These stimulate the heart, increasing blood flow to the skeletal muscles and constricting peripheral blood vessels, which in turn dilates certain parts of the body, such as the bronchi from patients with asthma. They restore heart rhythm during cardiac arrest and increase blood pressure in cases of shock. They also can constrict blood vessels to decrease bleeding. Androgenic blockers block the action of androgenics, so it's pretty self-wording there. So androgenic blockers block the action of androgenics, thus having a parasympathetic effect. So androgenic blockers treat cardiac arrhythmias, decrease high blood pressure, and they can relieve migraine headaches and chest pain. Because they slow the heart rate and relax the blood vessels to decrease the workload on the heart, it can do all of these different things. These medications include alpha blockers, which affect vascular smooth muscle, and beta blockers, which block the effects of epinephrine, causing the heart to beat slower and with less force, and thereby this reduces the blood pressure. Drugs that stimulate the parasympathetic nervous system to calm the nervous system are called parasympathomimetics or cholinergic agonists. These medications are rarely used because they severely slow down body system activity, and this also includes decreasing heart rate, and it constricts the respiratory passages. Anticholinergics, also known as cholinergic blockers, inhibit the parasympathetic branch of the autonomic nervous system and thus promote the fight or flight symptoms. These drugs dry secretion and are used for asthma and motion sickness. And they are also used for preoperative relaxation, neuromuscular blocking of spasms, and antidotes for insect stings. And they're also used in cholinergic crises. Cholinergic crisis is when there is an extreme motor weakness and respiratory depression, and this is caused by a surplus of acetylcholine. Most commonly, this is from an overdose of medication or as seen in myasthenia gravis, which we've talked about my aunt having as well, and we talked about how that can affect the involuntary muscles as well. That brings us to our comprehension check number 2. This medication class mimics the sympathetic system response. If you chose A, the androgenic agonists, also known as the sympathomimetics, you are correct. Now let's take a look at medications to control pain and fever. So it's important to note that pain is perceived in various ways among patients, and treatment is based on each person's perception of that pain. So one person's pain in a situation can be completely different than another, and so it is based on the patient. Analgesics reduce pain without eliminating feeling or sensation. Salicylates reduce middle to moderate pain, and they reduce inflammation and fever. Acetaminophen, also known as Tylenol, decreases pain and fever but has no anti-inflammatory effect, unlike if you're taking, say, an Advil where there is anti-inflammatory effect as well, like the non-steroidal anti-inflammatory drugs known as NSAIDs, which we have talked about in previous lectures. And NSAIDs reduce pain caused by inflammation and act on the inflammation itself. And NSAIDs also work on the fever. It's important to note here that aspirin in children, there is a risk, and the risk is Reye's syndrome. So if aspirin is given to a child with a viral infection, they can contract Reye syndrome. So that is something that doctors do not prescribe, and it is on warning labels, and it's important to know and remember that, especially in the medical assisting world. So now let's look at, this is still talking about the acetaminophen and Tylenol, which decreases pain and fever, but has no anti-inflammatory. Sometimes this is combined with narcotics to treat moderate to severe pain. So oxycodone with acetaminophen or Percocet is an example. So narcotics are strong painkillers that act to suppress the central nervous system. And the active ingredients in most narcotics is opium, so they're opioids. And because narcotics produce a euphoria feeling, they can also cause psychological or physiological dependence. And it's important that we know our patient's history with this. They are rarely addictive if taken for a short period of time, but unfortunately what we see is slowly they build up that pain tolerance, and they like that euphoria feeling when we do see patients that start to become dependent on opioids. So again, the non-steroidal anti-inflammatory drugs like ibuprofen, Motrin, Advil, they reduce pain, inflammation, and fever, and they may also be combined with narcotics to relieve moderate to severe pain. An example of this is oxycodone with ibuprofen. Then there's the opioid analgesics. These are strong painkillers. They suppress the central nervous system, and the active ingredients in most of them is opium. That's why they're considered to be opioid analgesics. They can cause decreased blood pressure, which may lead to risk of falls or death if it's taken in excess. Also, if taken in excess, can decrease the respirations. So again, when we see overdoses with this, it is very dangerous and life-threatening. And examples might be morphine, codeine, fentanyl. And just a side note, opium is from a poppy plant, if you didn't know that. Kind of interesting. Comprehension checkpoint number 3. Which of the following medications has no effect on inflammation? If you selected C, acetaminophen, also known as Tylenol, it will reduce the fever, but it does not work on inflammation. It's not considered an anti-inflammatory. Now let's look at medications to treat anxiety, insomnia, sedation, and seizures. So the limbic system of the brain is integral to the emotions of love, fear, and anger, as well as memories and levels of alertness. Medications can relieve anxiety. Medications can promote sleep or increase alertness. They can also help stop seizures. If the system is not operating optimally, it can work with this. Anxiolytic medications reduce the intensity of fears, danger, and tension. Barbiturates may be used to induce sleep by depressing the central nervous system in patients with insomnia. Non-narcotic hypnotics may also work to induce sleep with fewer central nervous system side effects. Barbiturates are used to control seizures, and hydantoins are a type of barbiturate that controls seizures by delaying sodium from crossing the neural membranes, and are the drug of choice for tonic-clonic or grand mal and partial seizures. Gamma-aminobutyric acid, GABA, is a neurotransmitter that inhibits abnormal neural activity. So some of the newer anti-seizure medications target this neurotransmitter. And some new medications increase the production of GABA or gamma